Uh, Travis is a good guy. He is works at the Kootenai Cancer Center in Post Falls. He's the social worker among other deals. He is also a group leader. He has a group that meets at the Post Falls Cancer Center on Mondays from 12 to 1. Travis, bless his heart, invited me online to one, and I met some of the girls, and it was fun. It's a good deal. So he leads a cancer group too. It's mainly breast cancer, right?
It's all cancer.
It's just it doesn't matter. Okay.
For
So,
women, yeah.
huh?
It's
For women.
Oh.
Yeah, I'll get more into that later. How that all happens.
Okay. All right. Very good. No, that'll be fine. So, okay. Well, without further me talking and yakking, I'd like to introduce my good friend and a great support, Travis from Kootenai Health, and it's all yours, babe.
Thank you.
It's nice to see some familiar faces tonight. First off, I just want to thank Jim for inviting me to present at his group. His work within the cancer community and the inspiration that he provides people and the hope, it's remarkable. So I feel grateful to be here tonight. As Jim indicated, I was supposed to present for him several years ago, and then the whole COVID pandemic happened, and that put an end to that. And so here I am tonight. A couple years ago, I had prepared a little PowerPoint presentation that I'll get into. And as I was messing with the PowerPoint today, I realized I don't really know PowerPoint that well anymore. And I remember being in college, and when I was going through my master's program for my graduate program, PowerPoint had just come out, and all the teachers and professors were all about it. And by the time I got done with college, I never wanted to see another PowerPoint. So I made it short and sweet for everybody. So my name's Travis Geib. I'm a licensed clinical social worker. I'm employed for Kootenai Health, and I am the lead social worker for the cancer clinics. And we have 3 cancer clinics. We have one in Post Falls, one in Coeur d'Alene, and one in Sandpoint. And so my role is kind of a jack of all trades. I help people with a lot of case management type needs and supports, whether people are in need of help with transportation, whether they need lodging, whether they need financial assistance, whether they need home health, hospice, palliative care, oxygen, letters for snow berm removal, military veteran claim nexus letters. And then we also do provide a lot of psychosocial support, which I'll get more into later tonight. I'm going to go ahead and show you our website. So this is our Post Falls clinic. It's really a state-of-the-art medical facility. I've been in the field for about 20 years, and I've been to a lot of hospitals in Spokane and in Seattle. And this is one of the nicer facilities I've seen. They did a really nice job, attention to detail. As you can see, there's a courtyard right here, and this is called a labyrinth. And then the infusion, where people actually get chemo treatments or infusion treatments, is right in here. And so it's a nice kind of like panoramic view. And there's some waterfalls. Some patients, will have infusion treatments for extended periods of time and may be there for 4 to 6 hours a day. So it's nice that they have something nice to look at in a nice environment. And
Where is that at?
so this is our Post Falls location. It's on 1440 East Mullen Avenue, literally just a couple blocks from here.
Oh, okay.
Mm-hmm.
Across the street from Northwest Hospital.
Yeah. And I really like how they did the labyrinth. So the labyrinth, what it's supposed to represent is, people's journey through their cancer journey. And I've seen several patients when they finish their treatment, they'll go out and they'll walk that whole labyrinth to kind of represent all the turns and obstacles that they had to encounter. So this says Kootenai Clinic is the regional center treatment, or is the regional cancer treatment center for North Idaho, Eastern Washington, and Western Montana. We deliver comprehensive, compassionate cancer care using leading edge technology, the newest therapies, and a wide range of clinical trials, as well as rehabilitation. To minimize the difficulties patients face traveling during treatment, our doctors offer cancer treatment in 3 locations, as I indicated, Coeur d'Alene, Post Falls, and Sandpoint. Here's some of our providers. Dr. Gay, Dr. Mulvey, and Megan are primarily in the Post Falls location, so I work very closely with them. Can I see a raise of hands if any one of these is your provider? Okay. And here is Dr. White, and he looks like Jim was able to track him down and get him on your schedule, huh?
We got him.
All right. So at our if you go to our website, you can actually see some testimonials of actual cancer patients talk about their treatment, their experience, and then you can actually kind of meet the doctors. So since Dr. White is coming, let's go ahead and see what he has to say right here.
The short answer is no. Not every cancer needs chemotherapy. We take so many different factors into account, including the cancer type, you, the patient, what stage you're in, and all of those things together with imaging findings, lab findings, will help us decide what treatment to recommend. Some treatments are chemotherapy, some treatments are hormonal therapy, we have new targeted therapy or immunotherapy, and all of these treatments are available to us. We want you to go into the process knowing as much about it as you possibly can. What I don't want is for someone to look at a television screen or to see a friend or relative going through chemo and think that that's exactly what they're going to go through. Each cancer has its own set of treatments, and we will talk about what fits you and what fits your cancer. No, not everybody loses their hair. There are a lot of factors that go into that, and certainly the drugs that we use, some are more prone to causing it than others, and the amount of chemotherapy that people get can certainly play a part. Of course, there will be side effects, but we have so many ways of treating the toxicities of chemotherapy so that we minimize the amount of side effects you feel. With the development of immunotherapy and with targeted therapies, we're using less and less chemotherapy as time goes on. But through every step of the way, me, my colleagues, the nurses, the dietitians, the social workers will be there to help you reach your goals. Everybody's cancer is different, everybody's treatment is different, and everybody's goals are different. But we want to meet you where you're at and partner with you to treat you in the best way that we possibly can.
Here are some of Kootenai's awards and accreditations. I have that just in case. So as you can see, multiple accreditations. The one that really stands out and that I'm involved with the most is the COC Commission on Cancer accreditation. That is considered, the gold standard for cancer clinic accreditations within the nation. Part of that accreditation process requires that the clinic have a medical social worker or clinician to address and meet the psychosocial needs of our patients. As we all know, cancer isn't just a medical crisis, it's also can be a psychological crisis, dealing with major life changes, adjustments, financial hardships, and that's where we come into play. And so my role, I am actually on the board and I am the psychosocial reporter. And so one of the things that we do is we have a workflow on how we identify patients that need the support and provide that support to them. And so when you go in to see your provider every MD visit, you will fill out a review of symptoms forms, which will go over, medical symptoms, but it'll also go over psychological symptoms and distress and life stressors. Based off the scoring on that form, that will initiate a referral to us so we can follow up to assess needs and provide supports applicable to the patient's needs. And we recently, we went live with a medical software program in March called Epic. And one of the things I was really involved with the Epic development team was how can we reflect and run the data off of the distress referrals and the intervention. And we were able to construct the system to meet our needs. And so I'm really excited about that. So I can actually run a report through all 3 clinics and see how many referrals were sent to us, and not only how many referrals, but based off of that referral, what intervention did we provide? And so we've developed some categories. And so at our next Commission on Cancer meeting, I'm going to be pleased to be able to announce that development. What is social work? I Googled it. And there's a lot of different definitions. I thought this one was pretty good. Social work is a profession concerned with helping individuals, families, groups, and communities to enhance their individual and collective well-being. It aims to help people develop their skills and their ability to use their resources and those of the community to resolve problems. When you get your initial chemo teaching and you meet with a collaborative nurse, you will receive a big binder at our clinic with a lot of information. This is one of the pages under resources that you'll find. And it gives you some examples of maybe what to expect, kind of what's our scope of work, what's our role to help our patients. Transportation assistance, nutritional supplements, lodging accommodations, wigs, hats, and turbans. We actually used to have a cosmesis room, and we would have donated wigs. It was a great resource. Unfortunately, with COVID and rules and regulations, we weren't able to continue to accept those donations. So I donated all of our wigs that we had to the hospice thrift store here in Post Falls. But I do have a lot of wig resources, and our providers will actually write like a script that can help with insurance processing. And so we'll get you that script and get you connected with a wig store or a resource to get that to help financially with the cost of those wigs. Education, palliative care and hospice, applications for financial assistance for local and national foundations. One of the really cool things about my job and my role is we have money to help people. Our Kootenai Foundation, donations from our community that go through our foundation, we have a program called Cancer Patient Support Funds. And what those funds are is they are utilized to assist patients that have a cancer diagnosis, that are in active treatment, or have had treatment within the past 6 months. And then there's a financial eligibility criteria. So we're looking at federal poverty guidelines, number of people in household, and gross income, which I will show later. And it's such a help for so many people. The adjustments that you go through sometimes when you're going through treatment, whether it is a reduction of income, for some people that don't have any short-term or long-term disability benefits and they're unable to work, maybe they have no income. So that money that we're able to help give them for gas and groceries is critical for them to access and obtain the care that they need. advanced directives. Jim had mentioned that too, like living will, durable power of attorney for healthcare, and the type of directives we deal with are just strictly healthcare directives. So, we're not attorneys. We're not going to help with trusts and executors and estates for assets, but we do help with healthcare directives. And I am actually trained as a honoring choices facilitator, and so that's a service that we also provide. So I can help people with living will, durable power of attorney for healthcare, and also with posts and DNRs. Does anybody have any questions about what a living will, durable power of attorney form is? Okay, and I'll actually show you later. As I mentioned, community resource referrals. We help a lot of people get connected with home health. We help a lot of people with short-term, long-term disability forms. Unfortunately, they ask a lot of questions that are really challenging and difficult, and they want MD certification. And so we will assist people in prepping that and for MD review, authorization, and signature. I also assist people with applying for Social Security through the Social Security Administration office for individuals that aren't able to work due to their medical condition or due to treatment needs and adverse side effects. And these are all things that can cause a lot of stress. And when you are trying to focus on your treatment and focus on your recovery, there's all these things, outside factors that can be really stressful. And so we try to alleviate that for you and provide that support so you can focus on your treatment. And I don't think you'll find any other cancer facilities around in our area that will offer the social service support that we do. So as I talked about, meeting the psychosocial needs of our patients, this is an example of what a review of symptoms looks like when you go and see your provider. And so this tool right here is, in our terminology, it's called the PHQ-2, and it's just kind of a standardized screening tool. And so, if people are feeling down, depressed, or hopeless, that's gonna trigger us to get involved. And so we follow up, and so many people, will tell me, "Oh, I'm doing fine. It was because, I had a bad day," and they're really appreciative to have somebody actually even follow up and call them. I've had people tell me, I've been answering the same way when I see my primary care provider or see all these other specialists, and you're the first person to ever call me to check in, and they're pretty shocked. I like to brag about our cancer patient support funds. Here's a little bit about the history. The Cancer Patient Support Fund provides assistance to those undergoing cancer treatment. The fund was created in 2006 in anticipation of the future need of cancer patients in our region. As we know, we're not getting any smaller. That year, the support fund assisted 77 patients. The program has grown steadily since its inception and now supports over 250 patients a year. This is actually an old slide. I'm sure we've just surpassed this tremendously. Shows in 2018, we were able to provide over $83,000 of financial support for our patients. Kind of a breakdown: nutritional supplements, utilities, rent. The other cool thing about this is we can utilize the funds if you're determined eligible to assist maybe with like a rent payment, a utility bill, a Vista utility bill. And there's our guidelines, which I've kind of covered and talked about. And when I determine you eligible, we go over those guidelines and I provide you that documentation. I believe I did forget to leave out the part about nutrition, though. Nutrition is so important. As Jim indicated, he was having difficulty with swallowing and eating. A lot of our patients, just due to the adverse side effects of not having an appetite or being nauseous, it's hard to eat solid foods and get in your nutrition, for the head and neck patients especially. And so if you're eligible for our funds, then you can access 3 cases of dietary drinks a month. And we have Ensure, and then we even try to complement diabetic patients, so we offer glucerna also. Here is a actual application of what it looks like. So, we're basically looking at, when you start a treatment, if you've had chemotherapy, if you've had radiation, if you've had surgery, looking at when your treatment will end, and then we're looking at, household income. And each year we update the document to reflect current guidelines. So this is the 2022 poverty guidelines. So if you were a household size of 2 and you were under, the 45,000, then we would be able to get you eligible. Support groups. That's another component to our accreditation and us meeting psychosocial needs of our patients. We have an all cancer support group. And so this is a support group for anybody impacted by cancer. It could be a spouse, it could be a sister or a brother, a child, a sibling. And if you ever want information on that, feel free to give us a call and we can, get you connected. Women's Cancer Wellness Support Group. That is the group I run. I am the only male social worker within our cancer clinics. How did I get the Women's Cancer Support Group?
But we love you.
So,
Yeah, we do.
my predecessor,
That's true.
my predecessor, she had been doing this for many years. Her name was Jessica Blankenship, and the work she's done to help people with cancer it's unbelievable. And this was her baby, so she had run this group for years. And when I came on, she was going to be taking another position. One day she introduced me to the group and to the gals. And so I sat in on a couple group sessions. And then when I took the position, I was like, oh boy, this has always been in Post Falls. I'm a guy. Maybe we can look at having one of my coworkers in Coeur d'Alene take over the group. And so I addressed it with the group at the time, hey, look, I'm the male. And they said, no, you're fine. We'll keep you. So I've had the group ever since. I've been with Kootenai for 5 years now. The wonderful thing about the group is, I want to go back to it, is it's the members of the group, and the camaraderie and the support that they give each other, whether it's needing a ride, to a medical appointment. I mean, I've had group members offer other group members who are traveling long distances, you can stay at my place. The information that you can get from somebody with a shared experience is sometimes a lot more powerful than getting it from any other source. And so everybody's cancer journey is unique in its own way, regardless of if you have the same type of cancer and you're doing the same treatment. It may impact one person differently than another person. The life stressors may be different. So cancer is just not in a box. It's so broad, the spectrum. And we have such a nice diverse group. I mean, we have ovarian cancer, we have breast cancers, we have lung cancers, we have anal cancers. And so it just provides a platform for people to have a shared experience. And I try to bring in guest speakers, just like Jim brought me in, and he's presented at my group in the past, and I'm hoping to get him back before 2022.
Call my
Um,
agent.
right. And we bring in, based off of areas of interests or topics, I try to branch out and find people, applicable to that. I mean, I've had acupuncturists, I've had attorneys, oncologists. We had somebody from Angel Flight just last week talked about air travel and donated pilot transportation to medical appointments for maybe people seeing a specific specialist, out of state. So just a wide variety of topics. So it's kind of fun. Unfortunately, with COVID, we had to go virtual because our patients in our clinic are so immune compromised, right? If they're in active treatment, we don't want to jeopardize that with a lot of people at once in a room. So we try to get creative. We do virtual, but when it's nice, we'll try to go outside and meet in person, because support group, I think in person is so powerful. Virtual has its limitations, and it can only be so impactful.
Travis, I have a question on the time. Does the time of that group ever come up? The 12 to 1 on?
No, it's 12 to 1. Yeah, on Mondays. Yeah.
Does it ever come why do you have it in the middle of the day?
Because that is usually when our providers are taking breaks, and
Gotcha.
it's the time that I would have the most availability to donate to the group. Yeah.
Gotcha.
The group is something that I wish personally I had more time for. A lot of times, I don't have time to prepare. I'm busy meeting with patients in person, helping them with case management, providing individual counseling. I wish I could find a little bit more time to prep for my group. But hopefully that'll happen here in the near future.
And by the way, if he's not available, we need any.
Yes, we do. That's good.
So,
I like
if he's
it.
on vacation or something, we meet anyway.
That's
And we
good.
often stay way after he leaves.
No, I'm sure.
Go to lunch.
We'll go to lunch. Yeah. Why, you won't pay for it?
I buy lunch sometimes.
Yeah, he has brought lunch.
She brings pizza.
Before COVID, we would do potlucks, and that was awesome. Everybody would bring something.
If we ought to do that, have a dinner group.
Yeah.
You've never done that.
Yeah.
Be good.
You guys are all right.
Um,
We'll steal that.
We'll give it to you.
So attorneys will charge money to do advanced directives, living will, durable power of attorney. There is a website, and this is the link to the website where you can actually access and obtain the forms of no cost, download, print them.
It's pretty easy.
It's pretty easy. Here it is.
Jessica had us fill them out at one point in time when she was working with
Mm-hmm.
and she kind of gathered them all up and sent them all in for us and stuff like that. So, I mean, it made it easier, but the form itself is not that hard to fill out. So,
What I learned about living wills, durable power of attorneys for healthcare is everyone should have them, regardless if you have a chronic health condition or medical condition. I mean, everybody should have one of these, because what it is in the event that you were unresponsive or in a vegetative state and unable to communicate your healthcare wishes, you're identifying what you would want those wishes to be. And then the second component of it is you're also designating an agent, somebody to be your voice, somebody to be your representation if you cannot communicate. And so
Travis, weren't you also telling us that ambulances have access to those records on the way to treat someone?
yeah, so like in our medical software system, it has like code status. So if you are like post DNR, do not resuscitate, it's gonna show up in the chart, and so yes, they have access to that.
Can I add something there, Travis?
Yes, sir.
If you guys are having difficulty finding those forms, come see a librarian, because we fill out probably a dozen of those, or help people fill out probably a dozen of those a week.
Wow.
For
Wonderful.
various different things.
I didn't know. That's great.
I didn't
Okay.
know. So,
I'm gonna delegate now. I can.
so if you're like, man, where was that form Travis sent us to? Just come and ask a librarian. We'll do it.
Good news.
Maybe we should have him at one of the meetings.
Yeah.
We're gonna have those right here on the table. How's that?
All right. I'm gonna be sensitive of time here. Here's, and hopefully this plays.
In 2004, I was diagnosed with breast cancer. I had 6 months of chemotherapy, very aggressive, lost all my hair, was very sick, and basically I was in bed for a year. And then I have been enjoying 15 years of being cancer-free. Last year, right around this time actually, I had been having pain in my belly for about probably 2 months. Hurt so bad, and I had been to the emergency room several times, did a CT, and at that time was diagnosed with stage 4 metastatic breast cancer recurrence. Dr. Kevin Mulvey, who is my oncologist, I found him to be a very thorough, caring doctor. I remember he even called me from his house one time to check on me because I was having a very bad time. We spoke and met and set out a plan of action, and I absolutely agreed with him 100% on the plan. I was in, and we started with radiation, which I had at the Cancer Center here in Coeur d'Alene. And then I began my treatments at the Cancer Center in Post Falls. I have to say that in addition to Dr. Mulvey, Megan Whitmore, that is his PA, is fantastic. I really like her. She has worked very closely with me. Anytime I have mentioned that something hurts or that I'm nervous about a certain feeling I'm having, right away she has scheduled scans, whether it's a CT or an MRI, to clear the air, to make sure that I'm okay. She's exactly what you want in this situation. She is caring, professional, beautiful. I would definitely recommend Kootenai Clinic and Kootenai Cancer Services because what you're looking for right now is a treatment that is inclusive. It's not just chemo, it's not just radiation. You want to think about the whole person in the entire situation and come to Kootenai Cancer Services for treatment, for emotional support. I'm doing very well. I'm responding to treatment. Last CT scan showed no new tumors, and certain tumors are actually shrinking. The tumor in my spleen has shrunk by probably 75%. My advice to someone newly diagnosed with cancer would be to allow themselves to feel everything that they're feeling and know that it is valid and that it is okay. Make sure you ask for what you need, because your husband, your wife, your best friend, your sister, your children, they're not mind readers. Ask for what you need. Find out what your options are and go forward. And lastly, love yourself. But if you've never loved yourself before, go ahead and start now. Because whether the outcome is good or whether the outcome is something that you didn't plan on, you are worth your self-love. You are worth it.
There's some other videos too, just that are really inspirational. Due to time, I'm not going to share them, but if you check out our website, hopefully you can find them on there. I'm going to kind of wrap it up. A lot of people ask me, "Oh, you work with cancer patients. That must be so hard." It's actually very rewarding. Cancer patients are some of the best patients, I think, in the health field.
Amen.
And, you know, the outlook that they have on life and what they've been through and just, you know, their overall perception, I think, you know, it really changes and brings some enlightenment. And I just enjoy working with our patients. And if I can provide some support, some relief, some security during a time of hardship, and be a support during somebody's journey, then it's really rewarding. So I really like my job. The environment and our team, our multidisciplinary team, make it easier to come to work for me. And I also provide individual counseling services. I'm a authorized billing provider for Kootenai Health. I'm in network with most major insurance companies. And for people that really need more one-on-one, you know, we can try to get you support too. So, any questions?
I have a question.
Yeah.
I always have questions. I get asked a lot, what is the difference between palliative care and hospice?
That's a great question.
Can you, I mean, that can be a long conversation, but can
It
you
can.
just help me
Yep.
to? Okay.
Yep, I can. And a great resource, if you ever wonder about that too, is the Hospice of North Idaho website. They do a really good job at providing the definitions and showing the difference between palliative care versus hospice care. So hospice care is considered end-of-life care, meaning that to meet eligibility for hospice services, you have to have a terminal illness. The miracle question is, how long do I have to live? And that's something, the will to live, it really can't be measured. But providers can know by looking at disease progression and, you know, looking at imaging, you know, examining you. If they feel that, you know, treatment is more detrimental than beneficial, or if you're having disease progression and have 6 months or less to live, then a lot of times they'll talk about hospice or have me get involved to advise about hospice services. So eligibility criteria for hospice is that you have to meet the criteria I just talked about, and then you cannot be pursuing or involved in like active treatment to try to prolong life. And hospice can come in and they can take care of pain management, comfort, durable medical equipment, those types of things. Where palliative care can work with people also with like advanced directives. So palliative care requires a diagnosis that would be considered terminal, okay? Treatable, but terminal. And you can be in active treatment to get palliative care. So you can actually be in treatment while getting that palliative care support. And they meet with people, they help people talk about those difficult conversations, like, you know, how do you want things to look? You know, what are your wishes? And they can provide that emotional and counseling support too. So that's kind of the difference. And Hospice of North Idaho and some other agencies offer in-home support.
So like in-home care, I mean, would they come in and like help you take a shower?
No, that would be more like home health. So hospice, yeah,
Okay.
like nursing support.
Okay.
Home health services would help with, maybe mobility, bathing, those types of things, wound care.
But palliative care doesn't.
It's not, to the best of my knowledge, I don't think palliative care provides like bathing support.
Is Tony James still with?
Mm-hmm. Yep, she's with us. Yep.
I'm gonna get her.
Yeah,
I've had her before. But
Yeah.
I'm gonna bring her back.
she's wonderful.
She did a great job.
Yeah,
'Cause that
she.
is- That question you have to know.
Mm-hmm.
You have to know.
Mm-hmm.
Thank you, Travis.
Yeah. Any other questions? All right. Well, thank you for everybody's time. Best of luck if you have cancer and you're in active treatment. Best of luck with your journey, and feel free to reach out and give us a call if you need any support.